good evening. Thank you so much for joining us for this special broadcast. We are coming to you live from two of our pages. We're going live on Twitter as well as Facebook. And you, of course, can watch this and be a part of this. We're live from the IHW Council and Allergy Free India pages. Now, I'm going to take this opportunity to welcome all of you to this discussion that we plan to have today about chronic urticaria management and patient-physician partnership. Now, if you remember, and I hope you do, in fact, I hope you'd also joined us last week when we had another such webinar where we discussed with renowned dermatologists what is commonly called the devil's itch, understanding chronic urticaria and its impact on quality of life. Today, we want to build on that and we want to share with you the substantial importance of doctor-patient relationship in urticaria management. Very, very happy since I had a chance to have a short interaction with them before we went live. I can tell you this promises to be a very lively discussion with our absolutely fabulous panelists today who are going to share their knowledge with all of us. Now, this year, given that we are in the middle of a pandemic, health priority. We all understand if we don't take care of our health, it'll in the long run harm us, and we'll not be able to take care of those who are near and dear to us. Now, since we have reached a new level of disruption in our lives because of COVID-19, with very little and less information available on urticaria in the public domain, here we are today to provide you with reliable and accurate information about this disease management. We observed World Urticaria Day on October 1st, and today we gather here to emphasize on the doctor-patient relationship and urticaria management. Now, before I go any further, I again want to thank all of you for joining us for this session. And since this has experts, and if you have any questions, and I'm sure you would have doubts or questions, you want to know more about this, all you have to do is type in your question, and I promise that I'm going to take your questions and ask those to our panelists on your behalf before this session ends. So all you have to do is type those in. And now we prepare for the next 50 minutes with an extraordinary group of committed doctors in the area of dermatology who will talk about this lesser known skin disease, urticaria. I will now introduce myself. My name is Stuti Ghosh and I will be moderating this panel, and with you, I'm also a layman, and we're going to try and understand what urticaria is. I will now, of course, introduce my panel for today. I'm going to start with Dr. Krupa Shankar, MBBS, MD, Skin and VD Dermatologist. He's joining us from Bangalore. Thank you so much, Doctor.
Pleasure.
Next from Delhi, we have Dr. Mukesh Girdhar. He is Senior Consultant Dermatologist, Max Hospital, Patparganj. Thank you, Doctor. Also very happy to have Dr. Sandeepan Dhar, Professor and Head Department of Pediatric Dermatology, Institute of Child Health, Kolkata. Thank you for joining us, Doctor. And finally, we have from Mumbai, Dr. Sushil Tehliani. He is Consultant Dermatologist, Hinduja Hospital. Thank you, doctors.
Thank you.
Now, before our audience asks you their questions, I think I have all of you to myself, and I'm going to begin by asking Dr. Krupa Shankar here if he could help us understand what chronic urticaria is and what are the manifestations of this disease.
Yeah, urticaria is in itself a very common condition. 1 in 5 people will get it in the course of their lifetimes. And out of these 5 people, 1 in 5 people will go on to have it for prolonged periods of time in excess of 6 weeks. So if it disappears in less than 6 weeks, which it does in the vast majority of people, it's called acute. If it lasts for longer than 6 weeks, it's called as chronic. Having said this, what is this thing we are talking about? Urticaria is a disorder which is characterized by itchy wheals, WHEALS, not ELS. ELS is the wheels for the cars, motorcycles, and bicycles. I'm talking of WHEALS, wheals. You know, a wheal is something, it's an itchy swelling which occurs on the skin and disappears without leaving behind a mark, exactly like an ant bite or a mosquito bite. All right. So urticarias can be of various severities, mild, moderate, or severe. There are some counts for that. We'll come to that later. And these wheals may occur only in a part of the body, the whole body, for a part of the day, or throughout the day and night, depending on how much of it, how much of the skin is involved, for what duration is involved, how often it comes, for how long it lasts. We judge on how severe it is. So basically, when we talk of urticaria, we are talking of itchy, red, transient, meaning to say not permanent
Yeah.
swellings which disappear without leaving a mark.
Right. Thank you so much.
Pleasure.
Thank you for explaining it so in a simplified fashion, Doctor. Next, coming to you, Dr. Girdhar, if you could throw some light on the severity of the disease and how does it impact the quality of life of the patients?
Yeah, severity of urticaria we measure. We do have some scales to measure, but for the lay public, I would say that somebody's sleep getting disturbed means a severe urticaria. Somebody's work getting disturbed, but sleep is generally okay. We'll call it moderate. And if it is, affecting your life in a limited manner, then it's a mild urticaria. We have some definitions regarding the numbers of hives also, like somebody is having less than 20 is mild, more than 20, 50 moderate, then more than 50 is severe. But then for somebody who has a single wheal on the face, for that person it may be severe actually. So why I'm saying this thing is because scales is one thing. Looking at the quality of life of the person is another thing. Somebody is in a meeting, develops a hive on the face. Somebody is, in an exam, develops itching all over the body. Somebody is in a meeting presenting something and develops itching on the body. Now, these are very important issues. And somebody is in a party, develops hives, you see. And you are with your spouse and you develop hives, your personal life is affected. So urticaria can affect the quality of life in so many ways. And if we don't understand these aspects, then perhaps we'll not be treating the patients correctly. Just writing medicine doesn't mean enough for the patient. Patient wants relief. The patient's condition has to be brought under control. The other aspect of quality of life is the medications which are used for urticaria. Sometimes they cause sedation, sleepiness. So these days, even a 5-year-old child is also having Zoom classes. You can't make even a child sleep when it is not required to sleep. So you have to have the medication which doesn't cause side effects like sleepiness. Sometimes they make the skin, the mouth dry. There is a disarticulation of the speech and so on and so forth. There are so many side effects of the medication also. But then at the same time, we have the medicines which can take care of urticaria without the possibility of side effects. So we have to understand every patient's problem from the individual point of view, and accordingly we should address that.
Right, right. Dr. Tehliani, since right at the beginning I had said this is a disease about which there's not enough information, and that myths that are associated with this disease, if you could throw some light on that.
The commonest that we encounter is people feel it's an allergy. Most of the times it's actually not allergy in true sense. And the next thing they expect you to produce a rabbit from the hat and tell them this is the cause of allergy, avoid it and you will be all right. And they're very keen to go for allergy tests. As a routine allergy tests are available in the country and in the world are not very useful. And one should not go for allergy tests. That's one myth. Secondly, people always try to associate this with a diet. And it may not be associated with a diet at all, but they would like to find out from you as to whether they should avoid sour food or spicy food or coloring agents. And many times, many of these myths are totally misplaced. And sometimes they feel that it could be contagious. It is not contagious, though it may be visible. And one more common myth is whether it will run in families, whether it will be hereditary.
Yeah.
So most of the time, these are myths which have to be demolished. We have to do a proper job of counseling the patient and explain to them.
Right, right. I'm sure a lot of people who are watching this would suddenly say, oh, that's something that we thought too. But here we have our doctors who are, of course, going to dispel all these doubts and myths. I'm just going to repeat again, since you joined us, if you just joined this live broadcast, if you have any questions, we have a fabulous panel here. All you have to do is type in those questions, and I promise to take them and ask those on your behalf. Coming to Dr. Dhar now. Dr. Dhar, everyone's so scared of COVID-19. Is there any link between COVID-19 and chronic urticaria? Dr. Dhar, I think you are...
Unmute.
You're on mute. Huh?
We couldn't hear you.
Okay.
Yes.
By and large, with COVID-19, a lot of skin manifestations have been described, and people who are handling, COVID, as well as we are doing our dermatology services, giving our dermatology services to the patients. Some of them have COVID, and also. So we get to see different types of lesions. But by and large, urticaria is a non-specific manifestation which can appear for any condition. There is nothing specific about COVID-19 and urticaria, right? Having said so, I must say that a number of skin manifestations or skin conditions which have been described in COVID, urticaria is definitely one of them. But there are at least 20 different types of COVID, skin manifestations which have been described in, COVID positive patients. So looking at urticaria, you cannot suddenly, jump your guns to that, patient has to be investigated for COVID. Nothing like that. Urticaria, my erudite colleagues have already mentioned that it's so varied conditions and so much of, psychological impact it has on the patients and as well as the patient families. Since I do pediatric dermatology, it causes a lot of anxiety in the parents.
Yes. Right. Next, I want to ask Dr. Krupa Shankar. But before I do that, at any point, doctors, if you feel you want to add something, please. Okay, you want to say something, doctor?
Yes. So actually, being in Mumbai, I've started seeing at least 2 or 3 patients per day who have recovered from COVID.
Okay.
And I've seen a significant number of them coming with urticaria, which is difficult to treat, which becomes recalcitrant. It needs much higher dose, sometimes 4 times the normal dose of the antihistamines, anti-allergic tablets. This is my observation, personal observation.
Right. I think it will help if we have doctors sharing their personal experiences. But right now, coming to Dr. Krupa Shankar, how do we manage chronic urticaria, and what are the available treatment options?
Okay, the management of chronic urticaria is very standardized, well established for over a decade now. And we do it with certain medicines called as non-sedative antihistamines. What does this mean? When you take a medicine, it will go to all parts of the body, including the brain. Now you want to block off, because in the brain also histamine has a role to play. All right, it's a mediator in the brain. For the brain to work, histamine is required. But the point is, histamine, when it is secreted in large quantities in the body, causes these itches and wheals. What we want are those medicines which will block off these in the body, in the skin, but not cross what is referred to as the blood-brain barrier and get into the brain and cause sleepiness. Those antihistamines are called as second generation antihistamines or non-sedative antihistamines, which is what we use. So the answer to your question is, we manage chronic urticaria, which is for longer than 6 weeks duration, with non-sedative antihistamines. The reason why we do it is, firstly, because of the safety, 2, to spare the tissues that I mentioned, and 3, chronic urticaria is by definition chronic, which can last for several months or years. We'll come to that by and by. And if you have to use a medicine for a prolonged period of time, it needs to be safe. It needs to be a drug of established safety. Those are the drugs that we choose and use in the doses about which we will talk as we go along.
Right. I want to bring you in here, Dr. Dhar, because he spoke about, of course, managing chronic urticaria, but in children, pediatric patients, how does one do that?
Yeah, definitely in pediatric patients also we see a significant number of chronic urticaria. Even 2 decades ago, the concept of urticaria or the hives, which have been described very well by my colleagues, used to have a concept. Physicians used to have a concept that urticaria in children means it is something, it is an acute in nature, and you need not worry, because it does not last for more than 2 weeks or 3 weeks or maximum 1 month or so. But over the last 2 decades, there is a paradigm shift globally, all over the world, including in our country, India also. We have been seeing in significant number of children of having urticaria with chronic duration, as high as 25 to 26% of the total urticaria cases in some series in India have been reported to be in children. That means urticaria continuing beyond 6 weeks. That is the definition of chronic urticaria. And in these children, the treatment needs to be, very, very well orchestrated from the very beginning so that their suffering is less. And along with the suffering of the children, the suffering of the parents also we have to keep in mind. Whenever we treat children, we have to think of treating not only the patient, actually we are treating the entire family. Because if a child cannot sleep at night because of excruciating itching all over the body, we can understand the parents also won't be able to sleep at night. And that does not only affect the child's school performance and other things, the parents' office performance also is grossly jeopardized, because nowadays most of the parents are working, right? So we have to give medication in a way that the child is also at ease, as well as the moment child is at ease, parents are at ease. And we definitely choose non-sedating antihistamines, as have been highlighted by my colleagues, because we don't want the child to have somnolence, daytime somnolence. And that's why we call them as second generation antihistamines, like fexofenadine is one of the main, second generation antihistamines, which I personally prefer for children, school going children mostly. And that is extremely safe and can be given for long-term purpose. There are other, antihistamines also for smaller children, like very commonly given cetirizine or levocetirizine, that are sedating. They can cause sedation or hydroxyzine. But treatment principle is basically more or less same as in case of adults. But there are certain differences. In children, we recognize the etiology of urticaria more often, percentage-wise more often, more than 40% of the cases, as compared to in adults, where we are not able to find out the etiology or what exactly is causing urticaria in more than 70% of the cases in most of the series. So that's why we call them as chronic autoimmune urticaria or chronic idiopathic urticaria, the earlier terminology. So the treatment of children is by and large same as in adult, but I must say that treatment of children with urticaria is a bit of more challenging than treating the adults.
And also a fair bit of counseling. I think a lot of parents of kids would be listening to this would greatly benefit with all the knowledge that all of you are sharing. Dr. Girdhar, I'm going to come to you, and if anyone else who wants to come in later. Now, India, doctor, is also the diabetes capital, and a lot of patients, suffering would of course have comorbidities. And in such a scenario, what is the mode of treatment? They also have chronic urticaria.
I think what you are talking of is diabetes vis-a-vis urticaria. Per se, there is no relationship between the two.
Right.
Directly, there is no relationship. But when it comes to treatment, then there are certain medications which will make diabetes worse. In any case, in urticaria treatment, we don't want to use steroids. Like steroids are the drugs which increase the blood sugar levels, can make the diabetes worse. As per our guidelines, as per our recommendations now, we don't want to use steroids at all in the management of urticaria, unless it's a very severe acute urticaria. We use it for 5, 6, 7 days or 10 days maximum. We don't want to use steroids. So diabetes as such does not, affect our management of urticaria. The urticaria management in diabetics also goes the same way. We give an anti-allergic medication, anti-allergic, that is the antihistamine actually. So second generation antihistamines, which are non-sedating, which don't affect your psychomotor performance also. What is psychomotor performance? Psychomotor means you are doing something, you get slower. You are driving, you get slower. You may have an accident because you become slower. So second line antihistamine, we increase the dose of the second line antihistamine as the second step. Then we have the next line medicines. The next line medicines can also be given to the diabetics as well as to the non-diabetic patients. But as the new theory is coming up, some of the patients may have, more severe manifestations if they have metabolic syndrome diseases like diabetes also.
Okay. At this point, Dr. Tehliani, I want you to answer this. From what I've understood, chronic urticaria, of course, means that it can last for years at an end, which means the patients will also be on antihistamines for that long. Does that affect them, and what would be your message to such patients?
Yeah, so first of all, if they come early, there are statistics to show that if you start treating a patient early, the total duration of the disease will be shorter. But having said that, about 50% of them will take 6 months or less to recover, and balance 50% will take more than 6 months. Few of them will take more than 5 years also. So what you have to tell them is that by taking this medicine, they can enjoy a normal quality of life. And you give them an example of diabetes where they have resigned to taking treatment lifelong, or blood pressure where they take treatment lifelong. Here it will not last lifelong, but we are giving them symptomatic relief without side effects till a time when the disease dies the natural death. So we are not altering the course of the disease. We are giving them symptomatic relief till the disease ultimately ends, and it will end. And then to supplement it, you have to show them studies done abroad where some of these have been given to 6-month-old infants for a period of 1.5 years at a stretch. So as Dr. Sandeepan would recollect, there's a study published long ago, it was called ETAC, Early Treatment of Atopic Children. From the age of 6 months in an infant till the age of 2 years with no side effects. And therefore you can tell them that this can be given lifelong without any side effects.
Can I come?
Yes.
Yeah, I think I cannot agree more with Dr. Taliani, having quoted the ETAC study. That is a landmark study on allergy management that had actually revolutionized the entire concept of treating allergy. You know, in my practice, I often face this question from the parents: the doctor, you are giving these anti-allergic syrups for my child or tablets for my child for 3, 4, 5 months. Is there any adverse effect or all these things? So often I quote the ETAC study, which was conducted basically in Europe and some American countries, Canada and some American, 18 countries. And it was given for more than 1.5 years to very small children below 1 year of age. And, that was given for more than 1.5 years. So that means it is absolutely safe. And the concept, even in children, we tell them that, look, there is no adverse effect as such for these anti-allergics, but still, as a matter of fact, just to check, maybe at 6 months interval, we will do a liver function test, because all drugs are metabolized in the liver. We'll have a check at the liver function test. In my practice, I do that. I do a baseline, because the child might be having a previous history of hepatitis and the enzymes may be raised, and I start the anti-allergics, and after 2 months, the child gets fever, goes to a pediatrician, and is advised liver function test, and they find the enzyme is high, and they come and tell me, doctor, because of this drug, probably this enzyme is high. So then I can tell them, look, the baseline enzyme of your child was high when even 6 months ago when I started the treatment. So I always do that. That is just for counseling purpose to the parents.
From what I've understood from this discussion so far is that how important, how crucial is the doctor-patient relationship, especially in regard to urticaria, because not just are there myths, but the patient, be it a young kid or even an adult, goes through. There's a social stigma that is attached to this disease. The myths, people think it's contagious. Here, Dr. Krupa Shankar, if you could come in and throw some light on how some of your patients are probably managing chronic urticaria successfully?
Yeah, so first and foremost, we need to understand that when a patient comes to us with an itchy disease, which is rendering him uncomfortable on a day-to-day basis, since they have come to a consultant or an expert of sorts, they assume that this is an episodic illness where the doctor is suddenly going to recognize which the previous 5 or 7 doctors could not. And then he's going to say, voila, you do this and you'll be cured. That is a false expectation. Chronic urticaria, immaterial of who treats it, is by definition chronic. Like diabetes or hypertension, it needs to be treated for several months or years at a stretch, with the sole difference being that in urticaria, we can expect to get off the medication someday, which in diabetes, hypertension is not true. It may be changed, but it will never be off. In urticaria, it will, like Dr. Tahliani mentioned earlier. nearly 50% of them are free by like 6 months to a year, another 25% by 2 years. And at the end of the 20th year, if we were to follow up a patient, only some 2-3% of the general population of the total population who got urticaria will continue to have it, which means the vast majority will be free of it in 1 year, to some extent 5 years, and an extremely negligible small number up to 20 years. The word 20 years is mentioned not because everybody should accept it for that long. It's mentioned because there is a very, very small possibility that it may occasionally in some patient last for 20 years. We wouldn't like to tell people what they would like to hear. It will be very nice on our part to say 6 months, it's magically gone, 1 year, it's gone, 5 years. No, that is not the case. That's why we lay out the whole thing on the cards on the table and tell them how it is. So point number one, when you see a doctor for chronic urticaria, do not expect a magical cure in single visit. That is point number one. Two, the drugs chosen will be chosen carefully, will be expected to be used for protracted periods of time. Typically, when you are treated for chronic urticaria, you will be seen at intervals of 3 months. So you have to take the medicine for 3 months. The dosage adjustment, if any, will be done by the doctor. Please don't experiment the dose in the interim. And as far as the other things that you said, myths and misconceptions, or the word that you used, contagiousness, that has already been addressed. The test, value of test, that has also been addressed. Curability, I have spoken to you. It's an eventually self-limiting condition. In the olden days, see, the big breakthrough in the management of urticaria happened with the advent of what are called as guidelines, where these guidelines not only guide us on how to manage urticaria, but with the advent of guidelines, one concept became very clear. From the time when we were students, say about 30 years ago, the assumption was always that urticaria is a reaction pattern, meaning to say there is something keeping it active. If you find it and remove it, urticaria will go away. We worked with this notion for like 2 to 2.5 decades of our practice. And then at the back of our mind, we always knew that the cause cannot be found in all the patients, in fact, a vast majority of patients. So the advent of guidelines, which has the collaboration of leading dermatologists from all over the world, made it very, very clear to us that urticaria, a cause may not be found in all. In fact, a cause may not exist. And we may have to look upon 2/3 to 3/4 of all urticaria patients as a disease in its own right and be dealt with as such. This is the major mental breakthrough which was achieved by guidelines and which makes us speak of urticaria with the kind of confidence we do today. Am I clear?
Absolutely. Yes, Doctor, you are to a large extent. Dr. Girdhar, here I'll come to you. He made a very important point about, going to a doctor, but not expecting magic, because doctors are not supposed to tell us what we want to hear, but what is a fact. Given the debilitating nature of this disease, how important is the doctor-patient relationship, counseling in chronic urticaria? What would you want to tell all those who are watching this live broadcast?
Right. So first, when the patient comes to us and we have established the diagnosis of chronic spontaneous urticaria, my first job with my patient is to tell the patient, well, this is a problem which can be, managed with certain medication. And this medication is also safe if it is taken on long-term basis. I often compare urticaria with diabetes and blood pressure in this sense, that in blood pressure and diabetes, you keep taking medicines for long periods without complaining, because you know that you have to take the medication. Whereas urticaria is not as publicized a disease as diabetes and hypertension, or not as illustrious a disease as diabetes and hypertension, because every family has some hypertension or diabetes patients, so they know about it. About urticaria, people are not aware. So I tell them that this is a disease in this sense that you have to take long-term treatment like other diseases, and those treatments are harmless, hence is our treatment also. But the difference between diabetes, blood pressure, and our disease is that this disease is harmless, it doesn't harm you. Number two, this disease will go away permanently on its own. And when that day will come, we can't know in advance as to when that day will come. And as has been mentioned by the previous speakers repeatedly, that we give some kind of time frame to the patient that, well, 50% chances that you will be cured of your urticaria in 6 months to 1 year time, something like that. We don't give them 10, 20 years prognosis because that discourages them. When we are counseling your patient comes for the first time counseling is different. The second visit counseling is different. Then we add more information. So in the first visit, we first of all convince the patient that this is your diagnosis. This is not an allergy to something from outside. This is something which has been, started in your body. It's like autopilot plane going on. So it's in the autopilot mode, and we have to keep suppressing it till this allergy goes away. So first target is to find the appropriate dose of the medicines for you. Once we find the appropriate dose, then we will keep giving those medicines to you for long-term basis. So this is what the basic counseling is. Then the second part of the counseling is that these are the medicines which are safe, which can be taken with other medications also. Normally, the anti-allergic medicines which we use, or the antihistamine medicines which we use, these medicines don't normally have interactions with the other medicines, because sometimes the patients are on other medicines also.
Right.
So you can comfortably, conveniently take these medicines without interfering with the other disease aspects, neither worsening the disease nor interfering with the functions of the other medications. Then the third aspect is that we have to tell them about the regularity of taking the medicine. Because, for example, I give the medicine and it is supposed to work for 24 hours. If it is working for 24 hours, it may work for 25 hours, 26 hours, but it is not going to work for 36 hours. So you have to remember taking your dosages, just like you remember the other diseases. Maybe you put an alarm in your mobile that this time you have to take the medicine, or you have the fixed time after breakfast and after dinner if you are taking the medicine. So that also has to be brought very clearly. Sometimes the patient say, doctor, I don't have too much of problem. Whenever I have problem, I take the medicine. Now, this also has to be brought out. If you take the medicine on SOS basis, then perhaps the allergy will not get suppressed properly, and you may suffer from the allergy for longer period. And then number two, if the allergy comes at an inappropriate time, like for example, I mentioned during the meeting or somewhere, it will be very embarrassing. So take the medicine regularly so as to get rid of the, your urticaria properly. So these are different points. There can be other things also, but this is what I emphasize on the first visit. Yes, besides there are one or two more things. I talk about alcohol because alcohol tends to aggravate urticaria. But at the same time, the antihistamines which we use, they normally don't interfere with alcohol. But alcohol does aggravate. Sometimes some artificial food items aggravate. Painkillers like aspirin, dispirin, they aggravate. So these are the things which are mentioned on the first visit.
At a time when this a patient is suffering from chronic urticaria, and this question is directed to you, Dr. Tehliani. Obviously he will not be relieved of those symptoms immediately, and patients can tend to become a little impatient and probably indulge in what we call doctor shopping, to basically try and go to a doctor who will tell him something that will, suitably relieve him of the stress. What are your views on this?
Actually, you have to be a good communicator. Just like in any other disease, over a period of time, we realize that we have to learn the art of communicating well, and then number of such people will reduce. And if they still want to try, you know that you've done your job well. And of course, you have to try and bring the symptoms under control fast, because the symptoms can be very distressing.
Right.
So that medicines could be increased in the, the number of second generation antihistamines. The pill that you give, you may give in a higher dose initially if you feel it's not coming under control fast, and then you may reduce the dose.
Right.
And you can definitely bring about a faster control because you understand their suffering also. And as Dr. Mukesh Girdhar said, there are certain factors which make it worse. Most of those you've already mentioned. And sometimes some of them, there are some pseudo allergens in the diet, especially coloring agents and preservatives. And some of them also see that when they have things like strawberries, which cause a direct release of histamine from mast cells, those tend to make an existing urticaria worse. So some of these few things, and uncommonly, you could find the cause. For example, some of them have a medicine-induced urticaria. And here some of them may have a very severe version, angioedema, because of some blood pressure medicines. If you recognize the cause and you eliminate the cause, some of them can be given a cure also. But those are few cases. And also we have probably not brought this out with clarity, so I thought I'll just mention.
Absolutely.
There's a group of cases of urticaria where you can induce the rash of urticaria wheal by stroking the skin, for example. Some of them, they will get it on the sun exposed area, some will get when they sit in AC. So in such cases, if you can find out the urticaria is inducible and the inducible cause can be avoided, again, you would reduce their dependence on medicine and you would improve the quality of life for them.
Right, right. have my share of questions, but we're getting so many questions from people who are watching, who've joined us for this live session. It's only fair. I should take their questions. Thank you, guys. Keep those questions coming in. This is a question from Namu. Dr. Dhar, you haven't spoken for a long time. I'll direct this to you. Is urticaria autoimmune and be cured and can be cured?
It is autoimmune in some patients, not in all patients, and that's why there is a special subgroup of urticaria which is called chronic autoimmune urticaria, or CAU in short. And yes, whether it is autoimmune or not, urticaria can be cured. The answer to the question of Namu is straight and very loud and clear. And here I must say one thing, that apart from whatever my esteemed colleagues have said, that Dr. Taliani mentioned about urticaria. He has seen urticaria cases in patients who have recovered from COVID. In children, it is very interesting that in children, urticaria, many cases of urticaria, chronic urticaria, they are precipitated by some viral infections. Say, for example, I have seen many children in the institute I work, Institute of Child Health, that after an attack of chicken pox, within 2 weeks, the child develops urticaria. In fact, I have seen children having chicken pox and urticaria simultaneously. But chicken pox healed in 2 to 3 weeks' time. Urticaria continued for 6 months to 1 year. So probably here COVID as a virus has precipitated the urticaria. That can be well extrapolated. That is one thing. And many other infections in children causes urticaria as compared to adults. Adults, we don't see infection producing that much of urticaria. So here immunological balance has got something to play a significant role. And in pediatric dermatology practice, what I have seen, that many parents, in fact many of the pediatricians of the children also, they ask our opinion, and the parents, they are often apprehensive that, doctor, my child is on antihistamines for such a long period of time, but a lot of his vaccines are due. Can these vaccines be given? Here I want to make this point very, very clear and transparent to everybody, that vaccine has got no role to play in urticaria, in children, in antihistamines, and there is no interactions of vaccine with antihistamines. And antihistamines are not immunosuppressives like corticosteroids or cyclosporin, that you cannot give a child vaccination, particularly live vaccine, when the child is on antihistamines.
Right. Coming to you, Dr. Krupa Shankar, here's a question from Sagar Kukreja, and he wants to know, I've been suffering from urticaria for the last 4 years. I want to know, is urticaria curable and how long? Any foods to avoid itching? So, of course, we can detect a lot of panic with people who are suffering from this, wanting to know, if they can get cured. But are there any food items that they should avoid?
Right, Mr. Kukreja, let me answer your question like this. In 4 years, you have experimented with a lot of foods, and what you have found is that when you avoid a particular food, it looks like it's going away. Next time you eat it, you still break out into a rash. So you are not certain. So there are certain substances collectively referred to as the pseudoallergens, of which there is a later list of about 18 substances. Alcohol, as mentioned earlier, smoking, very spicy foods, colored foods, bottled tin foods, and so on. Now, if you want to work out a correlation between food and urticaria, you should think more in terms of pseudoallergens rather than a specific food being responsible for urticaria. What I'm trying to say is, don't meddle with your diet. Go ahead and eat what you have always been eating. But if you notice specifically that at particular times when you take particular foods, it invariably worsens, avoiding the food will only lessen your urticaria. And please don't conclude that food is the cause of your urticaria and eliminating it is going to cause a cure. That is point number one. Two, to answer your first question, you had it for 4 years. Is it going to go away? Yes. Like I mentioned earlier, eventually it will. Like I told you, the benchmarks we have for this is 6 months, 1 year, 2 years, 5 years, 10 and 20 years. So we really don't know which of these groups you belong to. But then if you were to go by your own experience and you have been regular with your medication, with the antihistamines taken in the doses that are recommended, if you adhere to your dose, your suffering will come down significantly. But be that as it may, the answer to your question is yes, It will go away on its own. You just need to wait it out. In the meantime, please don't suffer. Take the antihistamines, the doses recommended.
Perfect. Perfect. That's the power of perfect communication, doctor. Yes, Dr. Dhar, you want to come in?
Mute.
You have to unmute yourself.
Yeah.
Yes.
Sorry, I just wanted to come in on two accounts. One is what Dr. Krupa Sankar, mentioned that food additives. It is rather than the food additives are very important. And nowadays, since I'm basically a pediatric dermatologist, I must say that pediatric population, particularly young adolescent, they have got a great tendency of going for fast foods. Pizza, pasta, and so many things, all canned particular counters rather than chicken at home. They are all fascinated by this. And I have experimented this. The mother complains that child has got urticaria because of chicken. I say, does your child get urticaria when you make the chicken at home? The mother says, okay, I'll observe and next time I'll let you know. The mother comes back and says, no, he doesn't get it. But when he buys chicken from outside counter, I'm not taking the name, then there may be a legal issue that that particular counter chicken, that particular made chicken, all these things chicken, that produces urticaria. So here there are a lot of things, sunset, yellow, tartagine, these are all food additives, to diet additives. These are more responsible, these are called pseudo-allergens, what Dr. Krupa Sankar said. Second is what Dr. Mukesh Girdhar said, very rightly, I fully agree with him, that he said that urticaria severity, what you referred to as what is the grade of severity, it does not always go hand in hand with the number of lesions present. A single urticaria over the face or swelling of the lips, which is called angioedema, is more distressing for the, socially more distressing and very difficult to accept. I have, couple of patients who regularly get swelling of their lips. That is called angioedema. And even these days also, they are coming with treatment partial response. Nowadays, they are very happy because they have to use the mask whenever they go out. That is the good side of using mask, so that their lips are covered. At least people cannot see. Earlier, they used to be very, very much embarrassed that I'm going to the office with the swollen lips and everybody is asking me what happened to you. I think this is the positive aspect of wearing the mask apart from the COVID prevention also.
Yes, Dr. Telyani.
So actually, knowing the rarity of relation with food, I tell them one thing. There's a science to telling them if you are sure so-and-so thing is causing it, stop it, and within a week your rash should settle down. That is de-challenging your system. And then you provoke your system by consuming it, and within 2 to 4 hours the rash should appear. If you can prove it, then you're right. If it does not happen that way, then you can safely consume it. That convinces them.
Right. Yes, Dr. Girdhar?
Yeah. So a very short comment I want to make on all this. See, we are trying to make the things simple for the patients. We are not making it complicated for them. So we put our points across very clearly, and we don't make something very big out of it. That if you see a relationship to a particular food item, especially these are only the artificial food items, you'll notice that. As Dr. Telyani mentioned, you discontinue for a week or 2 weeks and re-challenge and re-challenge. If 3 re-challenges are positive, then that thing is confirmed. Otherwise, we tell them at the same time during the consultation that this is not likely that some food you will be able to find, because they are all the time pushing us to find a food item. So we have to only tell them that this is the treatment, these are the precautions, and don't try to explore too much, because that way you are actually burdening yourself too much and making yourself frustrating trying to find out further causes.
There's another question from Kushnaz Mogrelia, and she wants to know, I had allergic asthma for 15 years. Later, I got 90% cured. Then I had bad allergies on different parts of my body, in my right eye, ear, on skin. It disappears after some treatment and then comes back again. Is this urticaria?
No, I think she is referring to, most likely, she is referring to atopic dermatitis. the kind of rash which she is mentioning, it's the kind of, what they call as atopic eczema. In common language, we call it atopic dermatitis, in which the rash stays for some days. If we treat it properly, in days or weeks, it should go away.
Right.
So atopic dermatitis and asthma, they are in the same category of disease, the atopic diseases. They can go together.
Right. Okay. Dr. Krupa Shankar, I'm coming to you with this. This is Ishani Majumdar, and she wants to know, I was prescribed medicines for urticaria for 1 month. I was cured 3 years back. Somebody want to okay. I was prescribed medicines for urticaria for 1 month. It was cured 3 years back. But again, I have it. It occurred last month. Shall I again take the same medicines?
No, please don't do it on your own. Like I said, in the vast majority of people, we can't detect a cause. That vast majority is in the range of 60 to 70%. But in about 30 to 40% of people, and especially those with acute urticaria, we need to say urticaria that lasts for less than 6 weeks, a cause can be found. The two commonest causes of acute urticaria are drugs and infections.
Right.
Drugs may include things that you have brought across the counter without any prescription. It could be ear drops, eye drops, nose drops, or tablets. Generally not creams. And infections. The doctor will run a brief test to find out if there's a focus of infection in the nose, ear, throat, tonsils, teeth, or in the gut urinary tract, or something like this, or in the chest. And then he will decide whether there is an underlying cause or this is a spontaneous urticaria. And then he will suggest to you how this disease is going to behave, what to expect of it, and what medicines to take. So the fact that you were cured of it in a month 3 years ago isn't a signal for you to go ahead and do this on your own now. You may be shortchanging yourself. Have yourself properly assessed and then begin, so that you will know what to expect of your current episode of illness. That's what I would recommend.
I think that's helpful advice. Ishani, coming to you, Dr. Tehliani. This one from Shri Parna Bhattacharya. I'm on medication for urticaria, but as side effects, I have sleepiness and dizziness throughout the day. But I can't skip the medicine. So how to deal with the side effects? Dr. Tehliani, you have to unmute yourself.
So probably she has been taking the first generation antihistamines, which cross the blood-brain barrier, as Dr. Krupa Shankar had said, and therefore she has these side effects. Of course, some of the second generation antihistamines can also cause sedation in especially sensitive people. But there are molecules like fexofenadine, there are molecules like belastin, which are expected to be totally non-sedating. So surely she should be changing her medicines and shifting to something that will work and control urticaria without causing sedation. That's what she should do.
Right. Dr. Dhar, this is a question from Jasmeet Sahani. What are the side effects of anti-allergic medicines?
By and large, anti-allergic medicines have very little side effect, if any. Only when the anti-allergic medicines are not being used judiciously and by proper experts and in proper dosage, then only the question of side effects come. When it is used properly and judiciously in proper indications, there is hardly any side effects. Second generation antihistamines by and large have no side effects, practically nil. But still, as I said earlier, it is better to do a repeat liver function test time to time, because even if somebody takes vitamin, also should do a liver function test time to time, at least 6 months, every 6 months. And first generation antihistamines, they have two major side effects. One is sedation, which all my colleagues have said. And second thing is the dryness of the mouth. This is we call as an anticholinergic effect. They feel very dry mouth, dry eyes, and these are the main adverse effects. Some antihistamines, when given, particularly first generation antihistamines, given in very high dose, they can produce, some neurological features like tremors of the hands and fingers and like that.
Right. Thank you, Doctor. Dr. Girdhar, I'm coming to you. Charu Raizada has this question. She says, I've been diagnosed with chronic idiopathic urticaria for 5.5 months. I'm on medication, nothing worked. One of the best dermatologists put me on medication, and in 2 months, I had very high BP. It's been a very difficult journey. What do I do?
Okay. Ms. Raizada, I'm sorry you had to suffer like that. But I must tell you, see, you said chronic idiopathic urticaria. Chronic idiopathic urticaria now we call as chronic spontaneous urticaria. They are synonymous. Now, as we were talking about, all of us have mentioned this thing, there is a step ladder approach to our treatment. We start with the antihistamines. Antihistamine, if it doesn't work, we can increase the dose to 2 times or 4 times. If that is not enough, we have add-on medicines to that. Now, here it is in the add-on category that, some people may give steroids. Steroids can increase the BP. I don't know what was given to you. That's one. Number 2, there is another medicine which we use that is called cyclosporin. That's a very useful medicine when it comes to difficult to treat urticaria patients. But we give it with caution in those patients who already have high blood pressure or who have a kidney dysfunction.
Right.
But even in a high blood pressure patient, it can be given if the blood pressure is controlled. But we have to do the monitoring of the blood pressure. We do the blood pressure monitoring, we do it the baseline, and then we do it every week. We ask the patient to check the BP every week. And if at any time the BP increases and continues to increase, then we have the guidelines for that. We discontinue or we reduce the dose. So BP can increase with a couple of medicines, steroids, which should not be given, cyclosporin, if it is administered without proper counseling, or if the counseling is given, the patient has not followed at the weekly interval BP checkup, because if the BP is going up, we can always withdraw the medicine and go to the next medicine.
Well, Ms. Raizada, I hope this was helpful. Next, Dr. Tehliani, I'm coming to you. This is a question by Ritu Shukla, and I'm sure a lot of other people would want to know, can stress causes so many things? How bad is it?
Yeah, actually, 30 years ago, there was a concept of psychogenic urticaria where stress would cause urticaria, but I can only say stress can aggravate urticaria. It's more likely the other way around, urticaria causing stress. But I don't think stress can purely be responsible for initiating urticaria. And people who suffer from high blood pressure because of the second line medicines, which Dr. Mukesh Girdhar said, have an option nowadays, if they can afford, of an injection which can control such difficult cases without the risk of high blood pressure.
Right.
There's injectable available.
Right. Dr. Krupa Shankar, I'm coming to you. This is a question, is urticaria treated better with thyroid medication?
No, it's like this. There are some anecdotal, meaning to say occasional reports of people with thyroid antibodies receiving thyroid medication and the urticaria disappearing on its own. But then we need to understand that anywhere from 30 to 50% of all chronic urticarias are actually autoimmune urticarias, and the association of thyroid autoimmunity is highest among those with autoimmune urticaria. So doing the thyroid medication in itself is not going to get rid of the urticaria, except for some case reports on which I don't know how much we should rely. But the thing is, we need to look at the thyroid disease in order to set right the thyroid function in its own right. In all cases of urticaria, not only do we treat the urticaria as we have been talking all along, we also look for if there's any other associated condition or is any other condition keeping this urticaria active. We address those as well. And in that respect, if you have a detectable thyroid abnormality, we would like to see if you have got a thyroid dysfunction, correct it.
Right.
But treating thyroid, will it improve the urticaria? The expectation is very small.
Right. I am completely out of time. So what I'll do is I'll take one final question. This is also a question I have a feeling a lot of people would want to know, but this one was asked by Vandana. She wants to know, are COVID symptoms likely to worsen in people with allergies? Dr. Girdhar, you want to take that?
See, these are COVID times, and we tend to relate everything that is happening with COVID, and the COVID is playing in our minds all the time. Even if we don't have COVID, it's playing in our minds, even the physician's mind, the patient's mind, lay people's mind. The fact is that the COVID will not be affecting the autoimmune diseases, and autoimmune diseases will not be affecting the COVID directly. Now, this is a very short period, 6 months time since we started having COVID in our country. So there are not many studies on that, but whatever available literature we have till now, it suggests that there is no relation between the two things.
Right. completely run out of time, but I cannot thank you, doctors, enough. Thank you for taking out the time, for patiently answering these questions. You took my questions, and all those who joined this live session. We had our doctors joining us from different parts of the country. Dr. Girdhar, Dr. Dhar, Dr. Tehliani, Dr. Krupa Shankar, thank you so much. And my takeaway is, of course, that first thing, we should stop just Googling our symptoms and being our own doctors. It's important to have proper diagnosis, and it's also important to have a proper dosage, like so many of you said, because sometimes the symptoms subside and people decide that they don't want to have that medicine, but that can actually aggravate your situation. If you're suffering from chronic urticaria, all our doctors have repeatedly been saying how it will be cured, but you have to be patient and take your medicines at the right time and the right dosage, and make sure you consult your doctors and trust their opinion. Thank you so much. Anything you doctors would want to say? A last word?
Thank you so much. Thank you, Stuti. It was pleasure interacting with all of us.
Thank
There
you.
is one last line I would like to add. This is with regard to the patient who was complaining of sedation. Please discuss with your doctor. If you are doing it on your own, it's highly probable that you are taking the wrong medicine. Discuss with your doctor, because every dermatologist in the country today knows which are the non-sedative antihistamines and how to adjust the dose. The sedation bit bothered me a bit. So I would like to reinforce that, get the correct advice.
Right. So please do that. Please get the proper diagnosis done. Speak to your doctors. And for all of you, for more information on urticaria and its management, you can visit www.allergyfree.co.in. Also, stay tuned and follow all the social media pages, Facebook, Instagram, and Twitter, for updates on various types of allergy management. On behalf of Sanofi India and the IHW Council and our presenters, thank you for joining us today. I hope all of you have a great day, a great weekend ahead. This is Stuti signing off. Thank you.
Thank you. Thank you.